Good morning, and thank you for joining us here on the Morning Medical Update. I'm Jessica Lovell. It is summer, and just like many of you, we are working hard to bring you some fun and exciting shows come fall. This morning, we are bringing you a rebroadcast of one of our favorite shows. If you have any questions, please leave them below. We will answer them during our live broadcasts on Monday, Wednesdays, and Fridays. So sit back and enjoy this Best of Morning Medical Update.
Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Welcome to the first edition of Open Mics with Dr. Stites. Hey guys, this is going to be dangerous, just so you know. You don't ever know what's going to come out of my mouth. And our broadcast team here in the studio is always just a little surprised about that. We're going to be together on most Wednesdays, and that's going to be pretty cool. We're going to talk with you about all things COVID, as well as many other topics. Jessica Lovell is here to take your questions, and as always, we will ask if reporters are on the line today. Today, we are fortunate to have KU Chancellor Dr. Doug Girod. Just to say, Doug Girod, I think, is one of the most admirable and admired people in the state of Kansas. He is a great man. He's a great friend. And we are so delighted to have you in the studio to help us kick off this program. We're going to have a little fun, so this will be good. We may even talk about fly fishing. Who knows? We may talk about Star Trek. I know that would shock everybody. And we're going to recap last year's success story during the pandemic. That, I think, is a story that should be told again and again, how well the University of Kansas did as they handled the pandemic on their campus. We're going to also hear about what's ahead for the fall semester and talk about the lessons learned. First, I'm going to share with you some of the inpatient numbers that we have from overnight. And I believe that our numbers are that we are around 38 inpatients right now that have COVID. We still continue to have patients, actually 29 active, 8 on the ICU, 2 on the ventilator, and 10 recovering, for a total of 39 patients. I think one of the things we still have to talk about is there are some vaccinated patients who are hospitalized. 6 of those patients are vaccinated, but that means 23 are not vaccinated, which is really good news, because if you've been vaccinated, it makes you a lot safer. What I think is becoming more clear as we look at the numbers here and around the world is those people who are immunocompromised may need additional vaccine. You see, that's what Pfizer is recommending. That's what Israel is doing. And Pfizer is starting to push out a little bit more about the definition of who doesn't do as well with vaccination as it compared to those who do. And it's really pretty clear that it's going to be those patients who are more immunocompromised who come around seriously ill almost all the time. Those are the patients who are chronically seriously ill or chronically critically ill. And those are the folks who we know and we see in the hospital a lot and we get worried about because anything can push them off their narrow window, their narrow ledge of where they have to walk to stay healthy. And even a small simple cold or a flu bug can do that. And so any element of COVID-19 can also do it. We have to make sure we are taking care of those patients as best we can, and that's going to mean making sure we have the right vaccination recommendations. Clearly, vaccine is the right thing to do. How much vaccine you need, that I think we still have to define a little bit more. Let's see if we have any reporters on the line first that might have questions for us.
Hey, good morning, Dr. Stites. Cody Holyoke with Channel 9.
Hey, Cody.
Hey, this just pops into my head as you're popping up the COVID counts here. How many of these infections are you seeing are people who have had COVID before? I'm just curious.
That's a great question, Cody. I'm not sure I know the answer off the top of my head. I'll have to research that and get that back to you. I know a few are. By and large, though, they are patients who have not had COVID, but I know that there are some are, including some of the vaccinated patients. But the ones who have had COVID and been vaccinated are still hospitalized, or those are like transplant patients or people who are on active chemotherapy. So those are people who we've wiped out their immune system. They're going to be susceptible no matter what. And so I think for those patients and people like that, we keep giving the same message. Masking, we know it keeps you safe. Staying socially isolated until your immune system has a chance to recover keeps you safe. So I think that's going to be the right recommendation almost no matter what. But we'll get back to you with better information about your question.
Sure. And then my actual question for today was about incentives. We're seeing Wyandotte County and some of these other counties really start to try to win people over, figuratively and literally, to get their shots. And we have some counties in our fringe areas and even not so fringe that have very low, relatively speaking, vaccination rates. So I'm curious your thoughts on incentives, and if we're seeing some of these comparable rates to places like Springfield, which actually Greene County I think has a higher vaccination rate than some of the counties in our area.
Yeah, you bet. So first of all, I'm going to say that, darn it, Jim, I'm a doctor, not an economist. I know, Star Trek reference, but to be fair, I'm not sure I really do know the answer to that question, Cody. I think that's almost more of a policy question than it is a medical question, and that's not a criticism. That's more a claim of ignorance on my part, in that I'm not sure how well incentives work. What I would say is that anything we can do within reason to get people vaccinated, I think, is really important. If you look at the New York Times heat map and you look at the risk areas around COVID, and I'm hoping that on Friday we can get some of that in front of you to see exactly what we're talking about. I think what you're watching is that the highest risk areas are encroaching Kansas City. And I think that's because of a lack of vaccination in an area. That's allowing the Delta virus to spread, and then that continues to be infectious even in areas where we see a higher vaccination rate, like Jackson County or Johnson County. And so, and then it starts crowding hospitals, which is where we're all a little bit nervous because we don't want to see what's happening in Springfield happen in Kansas City. So I think it's all about the vaccination rate. The more folks that get vaccinated, the better. And if there are ways to incentivize that behavior in general, I'm in favor of that. But I don't know enough about the specifics of it. I'm going to turn to the chancellor for just a minute, because I'm just going to ask, have you guys thought about that with students? Is there a way to incentivize that behavior on the campus?
We have thought about this pretty extensively, and there is some literature out there on this. And actually, the incentives don't work all that well, and in part because a lot of the folks who've not gotten a vaccine, it's not because they were incentivized, it's because they were making a decision that they didn't want to access it, or they didn't have access to it. As you know, that is still a bit of a problem for some people. That said, as we welcome our students back to campus, we are going to have incentives, we're going to have mass availability of vaccines, and we're going to encourage it in every way that we know how. We did pretty well on the way out in the spring. We had 2/3 of our faculty and staff vaccinated, and about 40% of our students vaccinated before they left. It was just becoming available to that age group, so we weren't able to kind of hit everybody, but we definitely are going to encourage that on the way back, and we will be using incentives for that, but we also know that's...
Front row seats to the basketball game?
Yeah.
Not quite there, huh?
They can share my seats. They are front row.
I like that. Well, I think, and I think, Cody, that's the challenge. What is, just as an example, playing off that for just a minute, but what is the incentive required to get people to do a behavior? And you have to constantly ratchet it up to get the most reluctant folks. And when you do that, what do you do for the folks who haven't gotten the incentive but got their vaccine early? Because I want front row tickets to KU basketball too. So, but in all seriousness, I just don't know enough about that body of knowledge to understand it or to make a really intelligent comment about it. I just know that the comment I can make is that vaccination is absolutely safe. It is absolutely effective. If you are truly immunocompromised, and you probably need to still be wearing your masks in public and social distancing, because the Delta variant is very bad. And I think that we just need to recognize we have to take care of people as best we can.
Thank you.
Other questions? All right. Well, welcome, Chancellor. So KU was a success story on many fronts last year, and many fronts, academically as well as medically. As you look back at it, what are your favorite highlights? What are your most concerning lowlights? What did you learn?
We learned a lot. No question about that. I think from highlights perspective, it was just great to see how the students were able to persevere. Really, the faculty were able to convert very quickly into an entirely new environment and then improve on that over the course of the year. But really, the success of the students, and to see students continue to win Goldwater scholarships and Truman scholarships and NASA scholarships. And
that's cool stuff.
See these students be able to really, really excel despite the many, many challenges that the pandemic posed for their academic environment. And then, of course, graduation is always the highlight when you're able to see them complete their academic career even in this challenging environment and go out and be successful in the world. I think the challenges were some of the unfortunate parts were the loss of a lot of the co-curricular activities on our campus, which is what's so valuable for our student population. And what they really shared with us is just not having those gatherings, whether it's lining up for 24 hours before a basketball game to get the best seats, or
that's kind of a cool thing. There's a culture about that.
There's a whole tradition around this that goes way before my time, but it's that is a thing, but that's just one of many things of the student organizations were not able to gather in person as much as normal, and so we lost a lot of that, and I think we lost that in the high schools, we lost it in the universities, and we lost it in society, of course, and so really excited to see all of that starting to come back.
So what's going to be the masking policy coming back to campus now?
So we're following guidelines of Douglas County and Lawrence and of Douglas County and the state, and really masks are not required, recommended for those who are not vaccinated or have other health issues, and certainly encouraged in that environment, but we will not be requiring masks on campus.
Okay, so even in crowded indoor spaces, what will you do?
Correct.
No
Correct.
masking?
Correct.
Are you, not a requirement yet?
Not a requirement, but again, if you're not vaccinated or if you have other concerns, we certainly encourage that.
Okay. And will students are they going to be required to be vaccinated against COVID?
So in the state of Kansas, we are restricted. We cannot require vaccinations or require vaccination passports, if you will, is the language for that. But we will be strongly encouraging it, obviously. We will be making it widely available to our students as they come back to campus, and recognize that a significant number of our students are international as well and may not actually have access to vaccine where they are.
Right.
So we want to make sure that we have it widely available for them as they come back on. And then as we think about students in our housing, they will either choose, but either have proof of vaccination or need to get tested on their way in.
And when it becomes FDA approved, assuming that it is, and that's a pretty safe assumption, I think, for Pfizer and Moderna at least, and J&J, then do you think that'll change at all as far as requirements?
Well, it can only change public policy changes.
Yeah.
Because there's statute right now around this.
And is influenza vaccine required?
It is not required, but there are others that are. So meningococcus and others for our housing students, not for all students, just for students who choose to live in our housing.
Right. So will they be able to get the vaccine up at Watkins Health? Will it be available?
Absolutely. It's available right now at Watkins Health to anybody on our campus, whether it's faculty, staff, or students. They can get it free at Watkins Health, as well as multiple other areas in our community. That will continue as we go into the fall. But actually, as we start to welcome students back to campus, we anticipate having multiple sites that they can have access. Where they're gathering for orientation and other activities, we hope to have vaccines available to make it as easy as possible for them if they choose to get it.
So what will happen if students test positive or COVID? Last year they quarantined. We had that whole thing all built out. What's going to happen this year?
Yeah, we're again following CDC and Kansas health guidelines, but really that's one of the biggest advantages of having the vaccine, right? The recommendations are if you are vaccinated and you have a close contact to a positive, you do not have to quarantine.
Right.
If you are not vaccinated and you have a close contact, you're going to quarantine just like last year. So just in my mind, that's one of the biggest reasons to go ahead and get vaccinated, is just to not have that disruption in our case, in your educational career.
And do you think the resident dining halls are going to operate differently this fall? Are they going to be more like normal, or
much more like normal? Much more. Obviously we're doing a lot more cleaning. We have a lot of and we're delivering food differently. But that said, it is going to be much more of a normal environment for us.
And I know we have kind of some important discussions upcoming, but give us a sense. Allen Fieldhouse, 16,000 people, 18,000 people, 2,000 people. What are you thinking?
We're trying to take the lead and lessons learned from what's happening in the professional sports right now. I don't know if you watched the All-Star game last night. It was pretty much full capacity. So we're trying to see how that plays out, and we have multiple scenarios ready to go. We would love to be back to full capacity, and we have a plan for that. But if it looks like that's not the prudent thing to do from a healthcare perspective, and of course, the good Dr. Stites heads our pandemic medical advisory team.
There's a lot of people who do all that work.
I know they do, but you convene that group and that advises us as we go through this. And so, and as we've been fond of saying, and it really hasn't changed. We've been saying it now for over a year. We'll know more in 2 weeks.
We'll know. We've been saying. I think we said it yesterday.
So we know that's true.
So just to say, I especially watched the home run derby Derby. Salvi Perez, 28 homers. You didn't get the recognition you deserve from ESPN.
Great showing.
Great showing, and he should have gone on to the next round, changed the rules so the people with the most home runs advance. That's just dumb.
Not just a pair up,
Yeah. Okay, so your COVID-19 dashboard is still active. It looks like you're still testing. You're going to keep track of that and showing it to everybody.
Yeah, so we are continuing to test, and of course that's pared down significantly over the summers. The students, the vast majority, moved off campus after a spring semester. So as you can see on this dashboard, this really just shows the last week with about 40 tests, and that's mostly people who are coming in and requesting a test at this point. 0 positives, by the way, and that's really what we've been seeing. Absolutely, that's really what we've been seeing for the most part. But really, if you go back to the very beginning of last fall semester, when working closely with the pandemic medical advisory team, we made the decision to test everybody on the way in, and then did that again in spring semester, and that's what now almost 66,000 COVID tests that we've conducted over the course of this last year. And that really helped us maintain a safe campus environment. We have no known episodes of transmission in an educational environment or a research environment or an office environment on campus. And where we did see things, obviously, was due to activity off campus, which we don't control. But we were able to isolate and quarantine and really prevent. We had no major hotspots on campus for the entire year, which is pretty remarkable when you think about that.
I think it's a good thing you're a doctor, just to say. I think that's helped us a lot. Because I think that testing everybody coming in also sent a message to the student body, we're taking this seriously.
Yeah, it really did. And of course, they got some early experience with what quarantining is all about. It's not that much fun, folks.
No, it's not.
So I think that really, and the students did a phenomenal job. They did. I mean, their compliance with mask wearing and social distancing on campus, I just couldn't be more proud of everybody.
I think Rock Chalk KU. So now I'm going to go off topic here. I do have all these other questions, but I'm going to ask my own. I know that shocks everybody, so here we go, because it is open mics with Dr. Stites. All right, so on a personal level, what was the most challenging thing to you last year?
I think our biggest challenge, which was everybody's challenge, was the unknown. We did not really know what we were dealing with, how best to handle with that. We were getting literally every 2 weeks new advice on what to do, sometimes conflicting advice on what to do. Availability of PPE, availability of ultimately a vaccine. Although you got to think about it, we're really frustrated, right? We're not vaccinated at the level we would like to be. Which of us really thought this time last year we would have a vaccine?
Yeah, good point. That's
and I just want to make a point on that, because we had the opportunity at graduation to honor Dr. Barney Graham, who's a KU alum and is the architect of both Pfizer and the Moderna vaccine back at the NIH. And frankly, without a KU Medical Center alumnus, we would not be here today vaccinated. So what a great story that is.
It is a great story. So looking back, you guys, there's the pandemic, right? There's the challenges, of course, always with funding from the legislature. There's the whole athletic challenge and the Les Miles saga, et cetera. Did you find any time to have fun last year?
We always find time to have fun. That's an important part of life, right?
It is.
Creating some balance, and but again, silver linings. Spent a lot of time with my family because that was my bubble, right?
Yeah.
So I had a wonderful opportunity to spend more time with Susan and the kids, and who are adults now, but a couple of them lived with us for a while.
Or did they still
so
like
far
you?
They do. Although one of them just moved out of state. You can take that where it is, but
it wasn't Susan, though.
Well, Susan and I just celebrated our 40th anniversary on Sunday.
Congratulations! That's awesome.
Yeah, she's. It didn't wear us out.
Yeah,
for sure.
So I watch you stuff. So my office sits back in the back corridor, kind of by the medical office building, and every now and then I get to see Dr. Girod walk out. He's always got a bit of a spry step after you've seen patients. Tell me about missing patient care.
Yeah, I
By the way, so you know that he's an outstanding ENT surgeon, has an outstanding surgical oncology surgeon, and we miss him here on our campus, even though he does a great job in Lawrence. So now,
I
with
miss that
preamble,
as well. But I still see my cancer patients, 25 years worth of cancer patients that I still try and stay on top of and stay in touch with. So I make it back several times a month anyway to run a small clinic. I don't get to go to the operating room anymore, which I really miss our team down there. But it's just been so impressive to watch how the department and the entire institution has continued to grow over the last 4 years since I've been in this role now, and a lot of that's been under your leadership. So congratulations.
No, I don't think that's it. But so. As you look back over the last year, and this is a new life, right? You went from I'm a doctor, to I'm a physician leader, to I'm a chancellor. lessons about leadership. What are some of the top 2 or 3 things you've learned along that journey?
Well, I think it's a great question, first of all, but I think it's also size and magnitude of organization, and I guess lessons learned would be the challenges of communications in those environments, and of course that's never been more important than in the middle of a pandemic, right? But trying to figure out, and having everybody dispersed, and so trying to figure out how you communicate with, in our case, we have 28,000 students, we have 14,000 employees and faculty and staff. That's a lot in 7 different campuses, and so how do you communicate effectively across that? And when I have the answer, I'll share that with you
yeah,
because it's a work in progress. It really is.
Yeah.
I think that is the biggest challenge, and I know as I had the opportunity to grow up in this organization at the health system, same challenge, right? As we have quadrupled in size over the last 20 years. Same challenges and things like this, I think, make a big difference.
Well, I think the one thing I would just say about one thing we try to strive on the MMU every day and now on open mics is that I think you have to find a way to be genuine and real and to be as honest as you can. And I think that way people believe your communication. And when people stop believing in your communication, then your message is just lost. And I think that trying to just be like that, I know that's who you are, because I watch you from a distance and I'm like, yep, same man I knew growing up right here at KU with me. So.
Well, I think you're right. And people talk about transparency, but transparency is really honesty. And honesty is we don't have all the answers all the time. And that is honesty.
Sure. It is true. We're building the airplane while we fly it. Sometimes the parts don't fit. Sometimes we lose
that's a hard message sometimes, and it frustrates people because people deservedly want answers. But we didn't have a lot of answers this last year while we were going through it. And so we did the best we could with what we had, and thankfully it worked out pretty well.
At the height of the pandemic, or the beginning of the pandemic, not the height, at the beginning of the pandemic, we were huddled around that telephone with the reporters crowded into this room trying to answer questions. And I think to myself, holy cow, I'm glad that was very early and we didn't make anybody sick.
Right.
But, we just had to keep building.
We did.
All right, Jess, I bet there may be some questions out there for viewers. I could sit and talk to Doug Girod all day long.
I know this.
Yes, because we haven't even talked about fly fishing yet. September 18th, 25th, Colorado. Remember that. Got the guys lined up. We've got the boats lined up. Okay.
Well, we have questions from the audience for sure. Dr. Girod, thank you for answering the Allen Fieldhouse question, because that was a big one this morning.
Yep.
What's that going to look like? How you're going to manage all that? So thank you for that.
And watch what I can do. This is not bad for a guy who went to Mizzou. And I still love Mizzou, but Rock, chalk, J-H-A-K-U. I've been here for 31 years. Okay.
You're singing on the first day.
We've adopted you. We've adopted you.
It was a risky adoption.
It was a risky adoption, but
See, there is a species of bird. It's called a tiger hawk, and I think those are real, and that those are the people who can cheer for both MU and KU.
Yeah.
Unless they play
Beauty
each
of
other.
living on a state line.
Yeah, I do. That's right. You're right there. Feel it every day.
Okay, now I'm going to ask Mary's question. So Mary wants to know, has the university upgraded HVAC in its buildings to mitigate airborne transmission of the virus?
Yeah, it's a great question, Mary. And
that is
the
a
answer
great
is
question.
yes. And we could not, be honest, we could not have done that without some of the federal funds that we received to help do some of those upgrades, massive upgrades in technology, but also in facilities. And not just cleaning of facilities, but how they operate. And HVAC was a very big part of that. We also went through the exercise of really looking at our spaces and looking at best standards of how crowded should a space be in an educational environment. And there are industry standards out there at about 25 square feet per student. So we actually have de-densified permanently some of our facilities as well. And then also what we originally had a lot of plexiglass around, thinking that was a good thing. Actually, our studies showed that slowed airflow, and actually that was not helpful. And so we've studied all that. We've maximized airflow because we know that's really important. And that's true not just in a COVID pandemic. That's true in influenza season. That's true all the time.
Any viral thing, you just want to disperse it. You don't want to concentrate.
I think we will have lasting benefit from what we learned over the last year for many years to come. And great question. And yes, we have.
I think isn't that a great point though? Look at how much we have learned during this pandemic, and hopefully once we get past the pandemic, we'll keep those lessons in our hearts and not forget them after a little bit of time.
So Sue is asking, why are we still under emergency use for the vaccine? Jane also says, why does it seem like it's taking so long to get that FDA approval? Is it?
Yeah, actually, it's not taking too long. That's also a great question. You guys are tuned in. Well done. Normally for a vaccine to even gotten to market, it takes 2 or 3 years, and these took months. And that's where people say, well, it took too long. It was too fast. many would argue that maybe we're too slow with new drugs on a routine basis because we don't feel enough pressure. And with a global pandemic, we felt the pressure, and so we responded in a way that maybe we could more often. Especially with technology that we think is new, like the mRNA vaccines, but really it's not new. It's over a decade old. So I think that I think that we are a little jaded by how fast we got the EUA, even though normally we don't ever give an EUA, so that's off the table. Normally we're studying this for 2 or 3 years before we put things out. But this time we did an EUA because of the urgency and the immensity of this pandemic. The second thing is that once you submit your data to the FDA, they spend an inordinate amount of time looking through that information to make sure that it's safe. And let me just give you a story of why it's so important. Because if people don't tell the truth all the time when they submit data, a number of years ago, a company made a drug for pulmonary hypertension, or for obesity and weight loss called fen-phen, and not all the information was given to the FDA. And as a result, a lot of people were injured or died from that drug. And because they developed things like heart defects and pulmonary hypertension and other problems. So you really want to do your research thoroughly on those drugs. I think what you're going to see is that the Pfizer, Moderna, J&J, those vaccines in the United States are in fact being fast-tracked. It doesn't feel like that, but there are billions of doses that have been given worldwide now. We have a better registry of these drugs than we have for just about anything that's ever come before us. So I think the FDA is fast-tracking it. It's not going to take 3 months or 3 years. I think it's going to take about 4 to 6 months for them to get through all the information to make sure they've got all the things recommended. And remember that even as they are considering these drug profiles, this information, they're constantly getting new information that they have to take into consideration. As an example, Pfizer saying, hey, there are certain classes of patients we think may need another vaccine after 6 months. Or J&J information about, hey, we may cause some Guillain-Barré in a very small number of patients. So I think that the constant influx of new information, the newness of this, even though it feels old to us, it's still a relatively new disease, the newness of this pandemic, and the weight and immensity of the information that's out there. It feels like it's taking a long time, but the reality is it's going really fast, and I expect that in the next month or 6 weeks we're going to be hearing stuff about this and whether or not those drugs are ready to go to full market and receive full FDA approval, which I fully expect them to do. And I think we just have to remember it's going pretty fast.
A follow-up question to that, which is we still have some age groups they're not eligible for a vaccine yet, and we're starting to see some hospitalizations in those age groups now with the Delta variant. So what are you hearing about the
great. That's a great question. You're not allowed to turn the mic around on me. That's not fair. No, I think the answer is that we're going to start seeing stuff later this month or in early August about the 6 to 12-year-old age group, and then I think in the early fall we'll start seeing stuff below that. So I think that's going to come out pretty soon. I think it's all going to be really safe. Remember the data in the 12 to 16-year-old age group in Pfizer? Yeah. That data was overwhelmingly good. In fact, that was probably the best data set we've seen. Incredibly safe and incredibly effective. Yeah. So I don't think there's any reason to believe that that's not going to be true the younger you go. I fully expect that within the next 3 to 6 months we'll be vaccinating every age group. I don't know how young it'll go, but certainly down to 2 years old.
You're spot on, because that's a lot of questions that people have right now.
They're important questions, I think, particularly as we think about going back to school in the fall for K through 12.
And I think the other thing, we just have to be honest with ourselves. We're feeling the third wave here, right? Here in Missouri and now in Kansas. We're beginning to feel that third wave. And I think because of the percentage of vaccinations, especially in more urban areas, we will be blunted. Oh, you guys got it. Look at you. You're the best. Nice. Look at those slides. Can you bring those slides back up for just a second? Got it. Okay, so this is vaccinations, and if you look at the light green versus the dark green areas, look how light green southern Missouri is. Look how light green northern Missouri is. Look at some of Kansas, and the dark green are the urban areas. You see it around Kansas City, you saw it in Columbia, you saw it in St. Louis. If you went back to that last one for one more minute, guys, you would see the dark green kind of down around the Wichita area as well. And Springfield's gotten a little bit darker. So now go to the next slide. All right, these are hot spots. So note that the hot spots, and this, by the way, is out of the New York Times, and you can go see this information. It's free and open to the public. But if you look at the hot spots, there's a hot spot in southern Missouri right where you saw the lighter green areas. And now Greene County is a little different because Greene County is Springfield, Missouri. But Springfield's catchment area is all these areas around it that had that very light green area. And you can see these are the hot spot. That's where a lot of the virus is. Now, look at the next slide about risk. You have that one? Okay, we're going to show that on Friday. What I will show you on Friday is that the risk area is climbing toward the metropolitan area in Kansas City. If we showed it to you in succession over the last few weeks, you'd see it happening. There is a wave that's occurring, and the wave is caused by one thing: lack of vaccination. We could say, well, it's a Delta variant. Yeah, but the Delta variant wouldn't be effective if everybody was vaccinated. The problem we have is it's tracking amongst patients who are not vaccinated. It's more easily spread, which is hard to believe because the original Wuhan virus was very easily spread. And here we are with the Delta variant, and it's still even more easily spread. So the virus is adapting. And what that means is it's becoming a little scarier and it's becoming a little more challenging. So I come back to our key points. If you are not vaccinated, you are not safe. And the Delta virus is worse. So, you know, every time you don't wear a mask, you're taking a gamble. Second of all, if you are chronically, critically ill, and those are the patients who are on home oxygen therapy, who are on dialysis and have heart failure, the people who have to be admitted in the hospital to be tuned up because their heart failure is out of order or their emphysema is out of order. You know, people like that, little things like just getting a cold virus can cause you to be tipped over and have to be in the hospital. Vaccination will probably make COVID-19 less serious for you, but you can still get it and you can still be tipped over. And that's what we're seeing in the patients who are coming back in the hospital. Plus, we know that those folks who are more immunocompromised and chronically critically ill don't have as good a vaccine response to any vaccination, not just the COVID-19 vaccine. So they may require a third vaccination. And if I was a betting man, I'd bet that at some point we're going to actually have that as a recommendation, just as Israel's doing. But I suspect that'll come, not because the vaccination isn't effective. No, it's actually very effective. It just may need more help in some people to be as effective as it needs to be. A lot of words there.
So Sherry wants to know, do areas like Springfield now have an uptick in vaccinations because of the uptick in the virus spread?
Yeah, that's a good question. And what I have heard, and I don't know the direct answer to this, so I don't know at all. I think there has been an increase, but not to what people had hoped there would be. And again, Springfield's not there. It's really the surrounding counties that are the big question in Missouri.
Okay, Sue wants to know, could you talk some about young, healthy people who were vaccinated early and now have symptomatic COVID? Are these cases being tracked so we know more about the need for booster vaccines?
Yeah, we're not seeing as much of the young, healthy people having symptomatic COVID. But remember that vaccination, what it says is it decreases the risk of getting COVID. It doesn't mean you can't get COVID. You can still get it, but you won't. You're very unlikely, very, very unlikely to need to be hospitalized or die from it, unless, of course, the vaccine isn't fully effective because you're chronically, critically ill. But in young, otherwise healthy people, we're not seeing those folks come into the hospital. They may get COVID, they may get sick, but they're not going to get critically ill or hospitalization ill. And I think that's one of the important points about the vaccine. That's why it works, and that's why it helps keep you safe. And it also helps prevent you from spreading it to other people because you don't have the same amount of virus in your body, which is probably why you're not getting as sick.
So Marianne wants to know, in the beginning of COVID-19, why was it that children and young people were not affected? Did they have stronger immunity than the rest of us in the beginning? Why are they now being affected by the COVID-19 Delta variant? Is their immunity that they had beginning to wear off?
Yeah, I'm going to go back to the stem of that question, the first part of the question. Say it again, Jess.
At the beginning of the pandemic. Kids did well.
Kids did well,
yeah.
And as we progress, now it seems like they're being more affected by the new variant.
Yeah. So first of all, I'd say in the beginning of the pandemic, let's pull that apart. Did kids really do well? And the answer is some kids did not, right?
Or young people.
Or young people. Same story, though. Some people did not, especially if you look at post-COVID syndrome or you look at the inflammatory syndrome that accompanies COVID-19. And you don't have to be sick, very sick at all. You may not even have many symptoms at all, and you can still get the long haul syndrome. So I'm not sure I agree actually with the first part. The second part I would say is, are they more at risk from the Delta virus? Yes. They're more at risk because A, it's more transmissible, and B, it probably causes more problems related to its ability to have a higher viral load in your body. That's why you're getting sicker. So the Delta variant is just worse, and I think that's really why people are getting a little bit sicker with it, and you're seeing it more in young people. And the third thing I would just add is that we think about is that, well, everybody's getting sicker, but at the same time we've relinquished mask mandates. We have people gathering together again, and now we have this new variant, and a lot of people aren't vaccinated. That's why I think if we took all those factors, we put everybody back together, and we took off all the masks, we let other people do what they want, I think we would have had a lot of younger people sick back in the beginning of the pandemic as well.
All right, Allie, I hope that also answered your question that you sent in this morning. Jeannie has a question. What kind of sensitivities or allergies would one have to have a doctor say to me that you do not need to get the vaccine or you should not get the vaccine?
Well, you know as much about allergies as I probably do, Dr. Girod. So I think the key is, are you allergic to any of the components of it? And having an egg allergy and things that we worry about with influenza are not the things we're worried about with this particular thing. Just to say, there is an occasional significant reaction, probably to some of the carrier molecules inside the vaccination, but those are very few and far between, and they are immensely treatable. So I think most of the folks with an allergy history can still get vaccinated, but if you have a question, ask your doctor, ask your allergist.
And I think Moderna and Pfizer don't have that egg component
they
to
don't.
it. So
they
even with an
use
egg
polyethylene
allergy,
glycol, which
you
is Miralax.
don't need to.
Right. You don't have to worry about those.
It might dictate which one you want to get.
Yeah,
but,
I think that's right.
But it really shouldn't prevent you. I think there are very few medical indications for not getting a vaccine right now.
Yeah, I think
the COVID vaccine.
That's probably the remarkable nature of the mRNA vaccines is how safe they are. And I know people are scared, they're new, et cetera. But if you compared it to influenza vaccine, if you compared it to MMR or DPT, you don't really think twice about getting the MMR and the DPT. That's what the mRNA vaccines are like, and they are incredibly safe. And again, we've now given billions of doses around the world, and I think we have a pretty good safety profile on these vaccines.
Yeah.
All right, Deb has a couple of questions. So are all the vaccinated people that are in the hospitals, or I think what she means to say, the people that are in the hospital, are they immunocompromised? That have COVID?
Those who had vaccines.
Those who have been vaccinated, yes, they are all immunocompromised. But there are many patients in the hospital who are not immunocompromised who have COVID-19 because they weren't vaccinated.
All right. If the cases continue to go up, can you see a time where masks are needed for all once again?
I can, and I'll tell you what would do it. One is a variant that is vaccine resistant. In that case, I think that's trouble, and we're back to where we started.
Which we don't have yet.
We do not have yet, but because we have so many people who are not vaccinated, the problem is that the way variants develop is they reproduce inside of us, and they make, and viruses are very tricky. As they reproduce in large numbers, they can make mistakes in their reproduction. That produces variants. Some of those variants make them less dangerous, but those are the variants that tend to die off. And then there are the variants that make them more effective as a way to spread or to cause disease. Those variants tend to stick around. That's why it's so important to get everybody vaccinated. If we can get everybody vaccinated, the risk of the new variants developing drops dramatically, and that's how pandemics end. As long as people are unvaccinated, there's a big reservoir of folks who can serve as a testing lab for new variants to develop. You're essentially allowing the virus to use your body to invent itself and reinvent itself. And so, you're getting used.
Which really is why this is a global question,
Yes.
not a local question.
Not a local
because this
question.
Delta variant didn't arise from
No.
propagation in the United States. It was propagated probably in Southeast Asia, where we did not have vaccination rates, and we had a lot of replication going on, which allowed the variant to arise. And so
Yes.
really, if we globally want to make sure we don't see that next variant that is vaccine resistant, it's in our best interest to make sure everybody gets vaccinated.
Yeah, the real experiment is not the vaccination. The real experiment is the virus inside of you. You're being used by the virus as a way for it to change itself into something that's even more dangerous. Don't let the virus use you. That's pretty good.
I like that.
I like that. Open mics with Dr.
amazes
Stites.
himself
We
all
just
the
got
time.
it. Yeah, well, it's not hard. If you start with a low enough bar, little jumps, they get you there.
All right, I'm going to give the last question to Donna. If we didn't get to your question today, we'll get to those tomorrow. Donna wants to know, she heard a rumor last night that vaccinated people cannot donate plasma. Is this true or false?
That's not true.
Not true. Yeah.
Simple enough.
Okay.
Back to you.
Yeah.
Final thoughts, Dr. Girod.
You know, I think we should take stock in where we are right now. We should be pleased with where we are right now, given the state of where we were 12 months ago. And yeah, we have a lot of work left to do. We know that pushing the vaccine will let us get back to as normal a life as we can, as quickly as we can. We're really excited about the fall. That could, of course, get derailed if a vaccine-resistant variant cropped up. That could completely change what we look like in the fall. But at this point, we're confident about our ability to get the vaccination rates where they need to be, and really will allow us to return to a pretty normal fall semester is our anticipation.
I hope so, because I really want to be back in Allen Fieldhouse. Those are some of my best memories, including a time we went there in the middle of the night for a basketball game and stayed up a few hours.
Stayed up a few hours afterwards.
That was a pretty darn good time. We may have to do that again. And now I want to get back to the Chiefs. I love going to the Chiefs again. Now I want to get back to Royal Stadium and not have to worry about stuff. You know, that question that was asked, do we foresee a time we could be back in lockdown mode and masks? We don't want to do that. And the answer is, how do we avoid it? You help us stay safe. Hey, tomorrow, Jess and Hawkeye will be back with the morning medical update. We've been talking about something all of us use, but is it safe? You may have seen this on your social media. Does sunscreen cause cancer? No. We'll look at that data.
Spoiler alert.
I know. I'll be back on Friday to help answer your questions as well. In the meantime, if you're worried about the Delta variant, I'm going to show you something I want you to remember in just a moment. But before I do, I want to riff for just a second. Not rap, riff. We're going to ask you to remember the Swiss cheese model of infection prevention and control. That question about, are we going to have to get back to masking? You know, man, that's just the most depressing thing to think about, right? It really is. And there's a way to avoid it. We've said it a lot, and we'll say it again. You know, the problem with the virus infecting you is you're getting used. The virus is using you as its own personal laboratory to experiment on you and to try and invent itself in a way that can harm others. You think vaccine is new? Yeah. That virus, it's out to get you. Vaccine keeps us safe. And this animated Swiss cheese video, remember the other thing that keeps you safe? The rules of infection prevention and control. And where do they go? They go with you because they travel with you wherever you go. Hey, we're going to be back next Wednesday with another Open Mics episode. That episode's going to focus on HIV. You know what? That's the second pandemic I've been through in my lifetime. The HIV was actually the first. This is the second. HIV was very real. You and I both remember that. Yes, and that was a terrifying time, just as this is. We're going to talk about that with some of our outstanding infectious disease doctors who grew up then also. In the meantime, a special shout out to my good friend, colleague, and fly fishing buddy, Dr. Doug Girod, the chancellor at the University of Kansas. Thanks for being my first guest on Open Mics.
Thank you for having me.
Hey, we're going to have you back.
Great to be here.
It's
Look forward
awesome.
to it.
All right, the best.
Thanks, Jess.
All right. Thanks, everybody. We'll see you soon.
Thank you so much for joining us this morning for this Best of Morning Medical Update. You can catch our live broadcasts every Monday, Wednesday, and Friday. And don't forget, you can always email us at medicalnewsnetwork@kumc.edu or reach out to us on Facebook, Twitter, and YouTube. We will be back to our live shows 5 days a week starting September 6th. So please go out, make it a great day.